We are talking with Dr. Peter Grevatt from EPA's Office of Children's Health Protection. Dr. Grevatt, thank you for being with us today.
Thank you for having me.
Explain why EPA is involved with children's health.
So EPA's primary mission is protection of human health and the environment. And of course, children are among the most vulnerable within the population when it comes to environmental exposures. And so focusing on children's unique vulnerabilities is a critical part of EPA's mission.
Why are schools such a priority for EPA's Office of Children's Health?
Thanks. So when we think about protecting children's health, one of the important things we have to focus on is where children spend time. And so of course they spend more time in homes than any other location. And then second on that list is schools. So every day, more than 50 million children across the United States are in public schools, many of them for up to 10 hours a day. And so it's very important for us to think about the environments in those schools, how they affect children's health, but also how they help to support or don't support children's achievement in schools, and including their scores on standardized tests and that help them to be successful.
Can EPA and the federal government in and of itself fully address children's health, or are the states needed?
States are absolutely critical partners in this effort to protect children's environmental health. And for EPA and also within the states, it's important to bridge between not only the environmental health departments, but also the public health departments. So it's a true partnership that has to happen between the federal government and the state and local governments that's spanning environmental factors, but also the public health factors that also drive children's health outcomes.
Children's environmental health really hits several different media. This is not something that's going to be just under the Clean Air Act, just under the Clean Water Act. How does EPA intend to address this cross-media approach?
Thanks. So my job within the Office of the Administrator is to look across the agency and make sure that we're working together effectively to address children's environmental health. And so you're exactly right that these issues span multiple media. So it's not just a matter of what's in the air, what's in the water, or what kind of chemicals we use. We have to think about how contaminants can transfer across the environment. And so we work as a bridge within the EPA to try and link together these programs and make sure that if we're thinking about a contaminant like lead, for example, and EPA has many activities related to lead, as you know. We're working on lead in aviation gasoline. We're working on the lead National Ambient Air Quality Standards for air. We're working with lead in drinking water through the lead and copper rule. And within the chemical safety program, lead in paint. And so it's important for an office like mine to be reaching across all these different parts of the agency to link together these efforts, making sure we're working from the same sound scientific basis and trying to meet the same overall goals. It's important for us to work with the Centers for Disease Control and then also to share that information with the states so they have the latest understanding of the direction that we're headed in.
What role do state policymakers, meaning state legislators, have in the protection of children's environmental health?
I think they have a tremendously important role. There are things that the federal government can do, but so much happens at the state level that's really important. And for example, that can be thinking about healthy school environments. There are a number of states that have policies or in fact regulations that may address issues like indoor air quality or lead paint in schools, or even asthma triggers. And those policies and regulations at the state level can be tremendously important in driving what happens across the schools in a given state. So the partnership with the states is tremendously important, and their role is very important in protecting children's environmental health.
What are the top themes you would like state legislators to know about EPA's efforts on children's health and about children's environmental health in general?
Thanks. So I think there are a few things that are particularly important. The first is from EPA's perspective. We're focused on children's environmental health and everything that we're working on, from the development of regulations that use the best science to thinking about safe chemicals management, including pesticides and also chemicals in commerce. And last, thinking about what happens at the community level and how we share information with local communities. And we think that kind of comprehensive view within the states is very important as well, to try and think, comprehensively about the issues that children are going to be affected by. We think that within the different media that we're working on, that air is tremendously important, as is clean water and chemical safety, pesticide use for children's environmental health. That children are much more vulnerable to environmental factors than adults, and it's important for state legislators to keep that in mind as well, and that we need to take active steps to protect children in our activities.